Well, good morning, everyone. Welcome to the third webinar in our 8-part webinar series, Communication Strategies for Community Outreach and Education. In this third webinar, we'll be learning about planning to maximize your limited communications budget. My name is Kim Norden, and I'm a program coordinator for the Delta Region Community Health Systems Development Program, or Delta for short. We designed these webinars to be interactive, so we'll be asking you to complete some polls and participate in a short group exercise to help us apply some of the knowledge we learned today. If you haven't already done so, please add your name, title, and organization to the chat box, which you can find on the bottom of your Zoom screen. I'll be sending the slides and recording of today's webinar to you all next week. If you have questions or comments today, feel free to use the chat box at any time. We'll save some time at the end of this webinar for our speaker to answer any questions that come in through the chat box. To avoid background noise and feedback, please remain muted when you're not speaking. Now, let me introduce you to our speaker, Mr. Mike Milligan, President of Legato. As a healthcare communications strategist, educator, and media trainer, Mike has directed strategic planning efforts for a variety of rural and other healthcare organizations, serving as counsel for CEOs and other healthcare executive team members. Mike is a highly requested speaker for healthcare national conferences, and he is a regular contributor to industry publications and blogs. Before founding Legato, Mike previously served in a communication leadership role for Previa Health in Green Bay, Wisconsin, and Director of Public Relations and Strategic Communications with Aurora Healthcare in Milwaukee, Wisconsin. When he's not writing strategic communication plans, Mike spends time with his family fishing, kayaking, and hiking with his 2 golden retrievers. Thanks for joining us today, everyone. Now I'll turn things over to Mike.
Good morning, everybody. And also this time of year, I'm getting anxious to start snowmobiling too. So I'm in Wisconsin, so or snowshoeing or whatever the case may be. So thanks everyone for joining us today. So what we're going to be talking about today as we have here is Planning 101 and called Maximizing Your Limited Communications Budget. What we're really going to be focusing on is how to determine where to invest your limited dollars and how to determine that. And we're going to put you to work a little bit too. We'll talk about a little bit later, but we're going to have an interactive exercise that Kim will help to facilitate for us, where we're going to break into some Zoom chat rooms for probably 15 minutes or so. You'll be kind of assigned a group, and you'll be forming some objectives kind of based on what we have discussed up to that point. So we're going to go probably till around 35 past the hour, and then we'll kind of start the exercise at that point. So okay, all right. So again, as you're well aware, but we're proud to be part of this initiative and the program through the Delta program. And so as I've kind of talked about today, what we're going to be doing is we're going to review overall a communications process. You may very well have one in place that you form. So again, like any educational opportunity, you look at it and say, oh, we're doing this, but maybe we could pick that up, or maybe we could do things differently. We're going to focus today on really how to form, measurable goals. We talk a lot in the realm of communications in terms of how do we know if something was effective or not, and the answer is, what were your goals and were they measurable? And then you can determine that. How to make priorities in terms of what you can do or can't do based on available resources, and again, measuring the effectiveness. And then as I've talked about, a breakout session that we're going to do. So just kind of start things out a little bit in terms of kind of where your comfort level is. We'd like to do a quick online survey, and the question is, how confident do you feel how confident do you feel, or how confident are you in developing business communication goals and priorities for your organization as part of your annual communications plan? Great. Seeing a pretty good consensus at medium confidence, or in some at high confidence. So excellent. So that's good to know. That's great. And hopefully after today, we'll even enhance those numbers a little bit for you. So as we've talked about, or as I've mentioned, forming a communications plan is about, forming those goals. Ideally, what you want to be doing is whatever you're doing communication-wise should align already with your organization's strategic plan. And so that it aligns with those goals. And those are ways that we can be proactive, as well as making sure that our communications plans are, that we're aware of what those strategic plans are and what those goals are. Because, obviously the two should work hand in hand with one another. And so where do you start, with this whole process? So we're going to go through with kind of a few overview things here, and then I'll dive into a little deeper in a couple areas. So first, it's taking a hard look at the past. So you're looking at, even, again, going back and looking at the strategic plan, but understanding even maybe how that strategic plan has changed, to kind of give you an idea of maybe where the leaders in your organization have evolved their thinking and where the priorities are and those types of things. And again, by having kind of those meetings that we talked about before in terms of with your leadership and those types of things, of having that understanding. So again, you're focusing your communications on those efforts. Again, looking at data, understanding the volumes, understanding market share, where you are, all those sort of things. The more knowledge that you have, the better position that you're in to actually form the goals that you want to form and the objectives that you want to form. And again, we'll get into that here in a little bit. Again, it's looking at a lot of information, just soaking in information. If you have community perception data, sometimes it's available, sometimes it's not. But if anything, for sure, you gather a lot of information from a community health needs assessment. And many of you might be intricately involved in those. And whether or not you are is to really, truly understand that, a lot of times, certainly what comes out of the community health needs assessments are, as we identify obvious gaps in service and things like that, but we also sometimes gather a lot of information just in terms of perceptions of where people are based on different demographics and things like that. Being aware of physician relationships, a lot of things that we might form in terms of goals in our communication, for instance, might be around referral patterns, those types of things. So having an understanding of that. And again, kind of establishing baselines for our goals and our objectives, and we'll talk about that now in a moment. So you're gonna kind of see this repeated theme, and certainly this for those of you that are involved in objective setting in your roles in your organizations, this is nothing new to you. There are different different ways and approaches of this, and certainly as if you're involved in your strategic plan, you're very aware of, this general concept. But in terms of forming objectives, that they're specific, measurable, achievable, relevant, and time-based. And I will repeat myself a couple times on this point just because it's so important. But as we look at this in many ways really serves as a management tool for us as we're determining what our objectives are and whether or not we achieve those objectives, and if we didn't, why didn't we? So as an example, sometimes in the communication world, we might hear things like, well, how do I know if that brochure was even effective, or how do I know if that the communications board that we had on the highway was effective? And the short answer to that is, what were your goals? Because oftentimes we're not looking at one specific element, but they may be part of a larger initiative, like we were trying to increase volumes in a certain area or whatever it might be. And again, we'll talk about those in more detail. So the point that I want to make here, and this is probably in many ways learning from experience, which is what we all do. But as we form these objectives in terms of guiding our future, that is actually probably the most important part of any kind of communications planning, is having a consensus on these objectives. And where I'm coming from in that perspective is that the discipline that we need to have here is that as we form a communications plan, what we do, everything that we do should match up or align with one of these objectives. And if we get new things that come in and they don't match one of those objectives, then we either have to say, okay, one, we're not going to do it, or secondly, we need to go back and form a new objective and look at our resources and such in order to get that done. But the whole idea behind why we do planning, whether or not it's our strategic planning or communications planning, is to stay focused and to stay disciplined. So what I have found, for instance, in my experience, either before I founded this company and now in working with customers, is that starts at the very top of the organization. So there might be certainly people in various roles in the organization that are helping to drive whatever tactics are being done in that plan, but not just your communications team owns your plan, your entire organization and your leadership team does. So, so that they're helping to really, you come to a consensus. And I realize that everything is fluid and we have new opportunities that come along all the time and we need to adjust that. But again, to be able to have that support from the top when we get, for instance, maybe miscellaneous requests that we know really, frankly, maybe aren't as important to the overall goals of the organization. And so if we can always kind of go back and use that plan as our baseline, that provides a lot of guidance. So when we look at, and we're talking here a little bit of kind of using the words goals and objectives interchangeably, and but really, and we'll talk in a second here, but I look at goals as kind of more of a broader sort of perspective, and an objective is where we get a little bit more into the measurement types of things. But in terms of how we form goals, we look at things from either there are certain business goals or there are communication goals. And so, and you could think of a lot of other areas that we've talked about actually in the other webinar as well. But business goals can come from obviously things like the obvious things in terms of profitability and patient volumes and how we're moving our market share, maybe what access to care that we have. Maybe there are goals around retention of staff or recruitment of staff, and a lot of other areas that you might think of. And again, I look at those as more of the, what I term more of the business goal that have a more direct correlation, I guess, to enhancing the revenue of an organization. And then there are what are called communication goals. Communication goals, which are still very important because they get us to helping to achieve some of these business goals, but they're more process goals in some ways. They could be anything from we're measuring the awareness of a certain service line or whether or not someone prefers it, or we're looking at a lot of metrics in terms of some of the digital things that we do, website hits, all things that are really important because they form a baseline and see whether or not we made improvement to that. But I would just argue that we need a combination of the two, because we could have a lot of communication goals, but they're only valuable if they're helping us achieve our larger organizational goals. We could have, we could increase our website hits by 800%, but in the end, if we're also not achieving our business goals of, increased volumes and those types of things, then we're maybe not accomplishing everything that we really should be doing. So when we look at forming these objectives, and again, I mentioned a few different things here, and you can see I kind of just expanded upon this a little bit more. And there very well may be other variables that you think about too, but these are just some things to think about. So when we form goals, we're looking at them, as we've talked about, to be measurable and to be specific and to have a time period. So you can see here, as you look at some of these areas, sometimes there might be a different objective within a primary service area versus a secondary service area. Market share, volumes, all these types of things. And the key why it's so important to be specific is that these drive then our strategy. These drive that you can see if you took this down more specifically, if you were, for instance, if you're looking at a difference between a primary service area and a secondary service area, and you were trying to increase awareness, for instance, of like you saw in your consumer data that maybe you had a lower awareness of orthopedic services in your secondary service area than you did your primary. Well, then as you look at your communications strategies, you're going to say, well, we're trying to move that number from this number to that number in our secondary service area. So as we look at our communications, for instance, maybe we're going to place more emphasis in this coming year on that area than we are in our primary. And then as we look at maybe there's more specifics in terms of certain demographics or payer mixes or whatever it might be, and all of those things, then we can then it really helps to focus us maybe in terms of products that we're offering or how we're actually reaching a particular audience, what methods we're using, all those sort of things. So it just helps to narrow that down as much as possible. And certainly, a lot of factors in terms of gender. The gender, sometimes can be, there's, depending on what it is that we're communicating, there's different ways in which people respond to messages in different ways, or maybe there's different, we have a lot of research that tells us in terms of differences between different generations in terms of how they like to receive information. So as I've kind of talked about, we have these goals and we have the objectives, and the goals, as we look at it, kind of a more broader sort of statement, and then the objectives are getting a lot more specific. So to give you an example, and we'll share another example with you as well. We have a goal here, actually I just mentioned orthopedics, could be any area, but build outpatient orthopedic volumes, assuming that you have that as a service or that you have a visiting provider that comes in to do some procedures, but this could be any area. So that's your broader goal, and most likely that goal is in your strategic plan as well, and whether or not you've got more specific in your strategic plan, some do and some don't. But as we look at then our communications objective, kind of keeping in mind some of those things that I talked about. So this is just an example: increase outpatient orthopedic procedures by 4% by the end of 2021 fiscal year compared to the previous year in the secondary service area with adults between the ages of 45 and 55. Okay. Now, I'd hope you agree, you look at that and you say, okay, that's more concrete for me, okay? Now, as I'm thinking about, and it's not like we're going to disregard other areas, but it just provides a lot of focus. And there may be a lot of different factors that came into forming that objective based on, market data that you've provided, input that you've gotten from your administration team, whatever it might be. And then from there, we're kind of familiar with, I'm not going into detail on that for today, but, the general approach is we have, objectives and then strategies and then tactics. So in this example, whoops, sorry about that. As we look at strategies, they might be, broader things like consumer promotion or physician referrals, or maybe we're going to launch a business health objective to do an injury clinic, for orthopedic care, whatever it might be. We list those sort of as broader objectives, and then under our strategies, then under each of those strategies would be specific tactics, and that's all part of your communications plan. I'm not necessarily going into all that detail today. Today we're focusing more on just forming those broader objectives. So as I mentioned, then you make that plan to determine that strategy, and we have an approach, and you might have a similar approach, but in terms of how to really make those decisions and those priorities in terms of what to focus on and what not to focus on. The general approach behind this is to look at a number of different factors that might determine how many resources or how much attention should be placed on various initiatives compared to others. And those resources that we talk about are certainly time and money. And the general idea is that as we go through a process of forming a communications plan, there are things that maybe warrant more attention than others not that they're not all worthy, but when we go back and we are forming and matching what we're doing against those objectives, it helps us to keep us pretty focused. So you can see here, you know, and you could certainly come up with others. And again, we've talked about this. This is a little bit of a review for you here, but, you know, we're looking at anything from, okay, are these, you know, is the service itself, is it market ready? You know, is it, you know, are there any barriers at this point to be able to release this to the community? Is it profitable? Is there a potential for downstream revenue? What kind of, as we look at our market audit, what kind of market share is actually, what kind of potential do we have? Do we actually have some kind of differentiation where we have something maybe up on our competitors in terms of our quality or service, what have you? Is there somewhere in what we're trying to communicate where we view right now our competition to be vulnerable? And can we frankly capitalize on that vulnerability? Do we have some other strengths in terms of our patient experience, those types of things? So we look at all those criteria, and it kind of depends on how academic you want to get with this, but I share it with you more from a conceptual basis, and you may come up with whatever form that you want to. But generally what we look at is where, based on those criteria, we break things into different tiers, and the tiers are meant to say that if something is in that initial tier, that means that 60% of all of your resources are under that tier. And so in essence, what that means is there may be only, for the sake of discussion, let's say you had a total of 20 different priorities or service lines that you thought you wanted to communicate. I mean, I would suggest in that regard, there's only 3 or 4 that are in tier 1, and you can kind of see the math and the logic behind that. That means that those are the areas that we're gonna focus and do and really produce those results. And the others are going to fall into these other tiers, but they're not necessarily going to get the attention. So if you look, you know, more specifically at how we might do that. This is just an example, and again, you may form different ways, but I don't know if you can see this or not real clearly, but we can certainly send you a copy of this. But this is kind of more for conceptual basis, but if you can kind of see on the left column, there's a lot of different service lines that are listed, okay? And then on the the top here is, you can see that there are those different criteria that I mentioned, and your criteria may be different, obviously, based on what you determine as an organization. And then we've actually placed weight on each of those criteria to give you a score. And then once you do that score, then it helps you put that into that tier. I'm not going through all those details today, except just to share the broader concept with you. So you can see here that, for instance, as an organization, you know, some of these criteria are profitability. Does it match with our strategic plan? Does it produce downstream revenue? And based on a number of these different things and how you've weighted them, it's kind of more of a scientific way for you to determine, you know, where to put those, so that a lot of the decisions that you make, there's a process behind it, so that when maybe you're challenged on certain areas from, you know, from maybe various physicians or what have you, that yes, we've considered all these factors and this is how we've made our determination. Because the fact of the matter is that we don't have unlimited budgets, and we need to be very cognizant and very strategic in our approaches. So as an example of that, as we look at maybe how we would break those into different tiers. So for instance, here, you know, as you started to look at those various criteria, you might say, well, based on that, these are the things that are in tier 1, and then these are the things in tier 2 and tier 3. So what that might mean more specifically is that these are the areas that maybe are going to get a larger budget. We're going to place more emphasis on. These are things that maybe in tier 2 that are still important, but for instance, when we look at our transitional care program, maybe it doesn't mean we're going to do a full campaign to consumers, but it means we're going to just look at the referral relationships with discharge planners and see what we can do to affect the communication there, but we're going to limit our resources in that way. So But anyway, you get the general idea. The approach here is the concept is just that you can't be everything to everyone, and it's really just trying to go through a process of making some difficult decisions, but in the end, it provides a lot of focus for you to meet those objectives that we've talked about. So I've mentioned here too the importance of getting that consensus from your leadership team, and with that, whether or not you're part of that leadership team or you meet with them on a periodic basis, but really incumbent to have continual dialogue, whether or not it's quarterly or what have you, to say, okay, how are we doing against this communication plan? How are we doing based on our objectives? And having certain dashboards maybe that we use to see exactly how we're doing against those objectives. And the purpose here is not to come in to pat yourself on the back. It's like any other data. It's to use it as a source of a management tool to make decisions. So it's being transparent to say, okay, well, these were our goals in this area, and it looks like we're trending in this area, or there might be areas where it doesn't look like we're getting quite there. So here's what we're going to do about it, or we need some guidance on what we're going to do. Again, it's kind of what we talked about before in terms of, building credibility with your leadership team as well. And it's just really looking at that data and using that properly, and then sharing that data on a periodic basis with leaders in your organization. So as I've mentioned before here, it's remember to stay disciplined. And I know that it's not a perfect world. Totally realize that things come up all the time, and those can be very good things. I mean, obviously, if we bring in a new provider or new specialty and it wasn't originally in the plan, it's not like we're going to say, oh, we can't do it, wasn't in the plan. But what it might require you to do is go back to leadership and say, okay, we had these objectives formed, we didn't plan for this, so we need to add this as an objective, but then, we either need to place less emphasis in some other areas, or we need to increase our resources, which isn't generally, not always very practical. But again, just having that disciplined approach, because otherwise, if you don't, there's generally, and it's just human nature, there's an expectation of, well, just add that and just take all the resources and divide them equally. And that just doesn't work. It doesn't work from a practical standpoint. It doesn't work from a messaging standpoint. So what we're going to do here is going to kind of give you a little bit more background before we kind of form the objectives. But let me just take a moment first before I go on. Just I kind of shared a lot there. Is there any questions up to this point that have come up, Kim, in the chat, or if there's any questions of anybody has, we could just open it up just for a second, Kim.
Yeah, absolutely. I don't see any questions in the chat box. You're welcome to add a question into the chat box if you have one, or you can unmute and use your voice to ask a question at this point.
Otherwise, there'll be time later, but just always like to do a quick check, Okay. All right. Sounds good. Perfectly clear, everybody, right? So everybody's just thinking, oh gosh, what am I going to have to do? All right. So what we're going to do here is we're going to talk, like I said, about establishing objectives on our own. And so the exercise that we're going to talk about here is, and again, this is, for the purpose of exercise and the purpose of learning, partly what we want to do as we break into these groups is what we're looking for, is we're purposely working in groups because we want you all to have some dialogue about it on your own as well, and they're based on the groups that get formed here. They're going to be people of different backgrounds and experience levels, and we can learn from each other. And then we'll do this for, like I say, 15 minutes or so, and then we'll pop back on and we'll share together some of our findings. So I believe, Kim, that there's some things here that I'm showing on the screen, but I believe these were also in the email invitation, right? In terms of some of these attachments. In terms of,
Yes.
okay.
Yep, in
Okay.
the Outlook email invitation, you'll find 2 handouts. So if you could pull those up and have them available, and then you can refer to those when you're in your breakout groups for the 15 minutes.
So what we have here is we have some broader goals here, and the exercise is to establish, depending on, your group. I mean, you might form 1, you might form 2, maybe you're overachievers and you form 4, but to establish up to 2 objectives for 1 or more of the following goals. And we'll kind of talk, and we'll give you some background here in just a moment. But so the broader goals are increasing surgical volumes in specialty areas, okay, in your organization. That's fairly broad. Improve employee retention, improve community participation in preventative health. So you can see here, by the way, that these goals are specifically in different areas. Some are more focused on growth, one's more internal, one's more from a community relations perspective, just to give you an idea of how eclectic we can be in our goals. So just to kind of review again, here's another example of, so again, kind of keeping in mind that the objectives are specific, measurable, and time-bound. So if we have a broader goal here of increased primary care volumes, then this is an example objective. We want to increase new patient visits, okay, by 5% by a time period, and maybe to have that time period compared to what time period. So if you say is it at that point in time? So if it's at December 31st, is that compared to December 31st of the previous year, or what's the time period? And then you don't have to do this, but here we've listed the primary service area, and we've actually gone down a little bit further and said among women between the ages of 30 and 45, because maybe in this particular example, as we've done our market analysis, and we've formed that, we've looked and said, we need to as an example, just hypothetical situation, but we need to focus more on younger families, or we need to focus on, reaching women of this demographic because we believe that, they're really the future of our organization, or, whatever it might be, if that's been more of part of a strategic goal for your organization. So that kind of just gives you an example. I'm just reading here on the comment sheet here. We have, please send a copy of the form. Oh, okay, I don't know if that form was related to this, or if that was that was for Tina. So anyway, everybody has a copy of that, I believe, on the email. But if you're referring to the other forms, I'll be happy to send those out.
Yeah, so, referring to the other forms.
Okay, sounds good. Sounds good. Thank you, Tina. So, so again, just as a kind of a reminder, when we're considering forming objectives, again, those were just some examples. You could go in completely different directions based on the situation. So to kind of remember that, again, we had those business goals and we had communication goals, and you could go in either direction on this, or you might decide if you're going to do one, if you're going to do 2, you focus one that's more on the communication goals, which might be more, again, things that aren't necessarily directly related to volumes in the business, but might be things about, you can see some of the things here like website hits or special attendance or what have you. I would encourage you, though, to at least have one objective that is more of the business focus part of it. But then you can see here there's some other parameters, secondary service area, market share, volume, maybe it's just overall awareness, maybe some, and there may be other parameters that you think about here, but age, gender, whether or not they have private insurance or not, maybe there are different things that came up in your community health needs assessment that you want to drive. So this background is given to you, really as a foundation. But as you can, I'm sure, understand that the more important goal here is that we're going through this exercise and this thought process. So having said that, I have provided you some, and this again is in your handout, so sorry for all the words on a slide, but But these are some things that you might consider as far as forming those goals. And I'll just go through a couple of these objectives. These are a couple things that might trigger some thoughts for you. And again, I think as you get together in your groups, I think this will become pretty clear as well. I won't read all of these to you, but you can kind of just see here that this is maybe some background, let's say hypothetically, that came from your strategic planning process, and now you're in a situation where you're trying to take that and form some specific communication goals. You can see here that overall there's an expectation to increase surgical volumes by 6% in your organization. However, if you look down a little bit, you'll see that or actually to the right, we have ample capacity in the specialty surgery areas, but general surgery is at capacity. And maybe it's at capacity because we only have a half-time surgeon or whatever it might be. But on the other hand, maybe we see, if you look and say, okay, well, we do have some potential in gynecology or urology, orthopedics, those types of things. So you can see here back on the left column, our marketing audit shows that we're going to have some tremendous growth in the next 5 years of younger families coming in. So maybe there's an objective around that. Or on the right-hand side, you can see here, this is more specific, but we noted from our community health needs assessment that we have a high percentage of type 2 diabetics. So anyway, so with that, there's some good background. And Kim, I'll kind of hand it to you now to kind of talk about how this gets divided up or how we do that. And then what we'll do though is then after you meet with your groups for about 15 minutes, then we'll bring everybody back together and have some conversation.
Thank you, Mike. Well, this is meant to be very fun. And so we're excited to get you together to have some conversation and share some of your experiences and ideas. So in a moment here, I'm going to send you all into a virtual room, and there'll be four to five people in each room. If at any time in your room you want to leave your breakout, there's a little red button on the right-hand side that you can press leave the room, and it'll bring you back to this main room. If you have any questions, you can do that. Otherwise, just make sure that all voices are heard in your group, and before you come back to us in 15 minutes, if you could just discuss within your group who is going to share your objectives that you came up with, that would be excellent. So here we go. Thanks everyone for participating.
Any quick questions before we do that? So, okay, sounds good.
All right, here we go.
Great. Sounds good. Well, welcome back everybody. I hope that was enlightening for you. I know it's kind of a lot to absorb in a short period of time. Let's just take a couple of minutes and see if we have time for a couple of people just to share. We won't have time for everybody to share, but I know Geneva, I think was your name, that I popped in on yours. And would you mind sharing the feedback from your group?
Geneva, you need to unmute yourself.
Okay. Okay. Our objective was, because you said that our objective has to be specific, measurable, achievable, relevant, and time-based. So our objective was, with our visiting urologists, to increase the number of outpatient visits by 5% in the year 2021. Okay, so we can get a monthly number that visited from 2021 and compare that to 2020, Okay, so here's where I'm having a little problem with our goal. What we were going to do is use a marketing plan and really push the days that our visiting urologist is here, the types of services he provides. Would that be our goals then, our marketing plan?
Well, let me comment on a couple of things. First of all, your objective is right on, very close. We could get a little bit more specific. We could, for instance, talk about that time period a little bit more to define that from what period of time to what period of time. outpatient volume is good. You know, we could get more specific if we wanted to in terms of maybe the types of outpatient procedures after we kind of went back and looked at, you know, what the revenue might be on certain procedures over others, for instance. So that might provide a little bit more focus, but overall that's good. The question that you had regarding, you know, the marketing plan and such, that very well may be needed, but that would be more in lines of strategy at this point. So that's how
Okay.
that we wouldn't really need at this point, you know, because there might be other things where maybe you don't even need traditional advertising because maybe, for instance, you'll determine that your strategy is more on a referral pattern that we need to look at, or whatever it might be to help us achieve that objective. So excellent. Thank you very much. Would anyone else like to volunteer an objective? Or otherwise we'll volunteer you.
This is like being in the classroom.
Were you a teacher, Geneva?
Yes, I was.
Okay, all right. Who else would like to volunteer?
This is Randy. I'll talk about our group.
Great.
We just kind of took the employee retention
Great.
thing, kind of
Great.
went with that
Great.
to determine first, you know, we kind of outlined to develop a goal. We have to know where we came from over the last several years to kind of
Yeah.
see, and then define what we agree is an acceptable level, knowing that all hospitals are going to have a level of retention, and we'll work with the HR department. But we also need comparative data for other real hospitals to see what is the norm, what are everybody seeing. And this is, again, pre-COVID, because we talked about that too, how COVID is really disruptive and making it very, very difficult.
Right.
And for a lot of the hospitals. But once we kind of take all that analysis, then we can develop a goal that says our goal is to have a decrease of X over the next 6 to 8 months, or our goal is to be at, you know, 4%, 5% of that. So that's our goal. And then we got to drill down into the data in the departments. There's maybe 1, 2, or 3 departments that are causing that. And maybe we need to look, is it housekeeping or is it in dietary? And maybe that's where the situation is. So we could develop our, what is causing it, the factors. Is it because we got a disgruntled employee in that department? Do you have a director that's not doing an effective job? Number of factors. So you can look by department to really determine what is that. Or it could be just overall, is it a disagreement with the HR director? Is it? So we need to really drill down in the data to really determine that. So that would be the steps we would take once we define our goal is to reduce our that whatever percentage we agree is determined. So that
So
would be, go ahead.
Oh, so how would you determine, how would you measure that, are we talking in particular about retention, or are we talking about employee engagement, or what's our objective?
Well, our objective is to decrease the number of people leaving. And what is our retention percentages? Say it's 5% or 6%. Is it going up? We need to bring it, you know, we need to retain those people. What is causing that?
Okay.
So we need to determine what is the factors that's causing that retention, thus to see our levels go up, so we can say, is it in that particular department? We'll work with that department, but that department director doesn't have the good managerial experience, and so she's not working with her employees. So whatever that factor is, so that was our goal, to work with it. And then we would develop our action plans by department or by overall, once we determine the factors that we feel is causing it. So if we feel that in that one department, say dietary, maybe it's not enough pay, maybe the pay is too low, or maybe it's competition with other places. So we put all those factors together, and that's how we would kind of go about. And then we'd set up a timeline of when, you know, 6 months to 1 year, or maybe 2 years, sometimes to get that go down 1% or 0.5%. Sometimes it may take a good while, but you have to know all the factors. So setting our goal of where we want to be based on other rural hospitals and where we want it to be. And we may want to be better than other rural hospitals. So what are we going to do, and where are we going to find what's causing it? What can we do about it? And then set those goals and step by step work with HR and improve.
I think that's excellent feedback. I wish we had more time to elaborate on this. I guess it's a learning lesson, because I really enjoy the engagement on this. And I think as we do other webinars like this, and we're going to accommodate maybe to do that a little bit more, I think it's really valuable. I think for the sake, thank you, Randy. I think for the sake of time, we have another poll question here just to end it out, the same one. Kim, has everyone answered that already? Looks like. Can you still hear me? Okay.
Who were you asking if they could still hear you? This is Geneva. I can hear you.
Okay, thank you.
Yes, go
Okay.
ahead, Mike. We're
Oh,
good.
okay. Okay, sounds good. So anyway, it looks like we had some good improvement here. So in terms of confidence level, so that's great to hear. Want to thank you all for attending, and certainly as you had feedback on your objectives, reach out to me again if you would like some feedback on that. We're you know, I'm glad we had some good discussion, and it's just hard to move all that in within an hour. So our next webinar is going to be on, it's going to be a great one. This is going to be with Dr. Farrell. We're going to be talking about strategies to customize messages based on generational and cultural backgrounds. It's going to be a good one, a good co-presenting opportunity. And again, if you have questions, want to talk more about any of these things, feel free to reach out to me. So thank you all for attending. Kim, any final words?
No, thank you, everyone. Have a great afternoon.